a couple minutes away. So we're going to go ahead and get started, everybody. Welcome to the diabetes class. Hopefully, whether you're new to diabetes or you've had it for a while, this is all important information. We're basically either going to be giving you new information or some of it should hopefully be a refresher for you. We're going to go over some key parts of managing your diabetes with the diet. And at the end, we're going to start talking about blood sugar tracking a little bit, which is important for everybody, whether you're doing it now or not. So all I ask is just hold your questions until the end. We're going to try to roll through this in about 45 minutes to an hour, and then we'll have enough time for you guys to ask as many questions as you want. So just to get started, we're going to go over some of the obvious information. We're going to get some of this stuff out of the way in case you guys have any questions about how you have diabetes or why you're doing the diabetes diet. So foods that you eat directly impact your glucose levels. Obviously, managing your blood glucose level is key to diabetes management. So your carbohydrates are what gets converted into glucose. So that's why we're going to go over carb counting. So your type 2 diabetes occurs when your body cannot make enough insulin or doesn't use the insulin that it makes efficiently. And that just happens over time of your blood sugar being high enough to where your body has to continuously make enough insulin to react to that high blood sugar level to start taking that glucose out of your system. Naturally, you start to get resistance to insulin and your body starts to make less of it. So that's why sometimes you'll be prescribed insulin to help you with your blood sugar levels. When your blood glucose level is high over a long period of time, that's what causes damage to your internal organs, such as your eyes, kidneys, liver, your heart. You'll start to, at some point, you might have this thing called neuropathy, which is a thing that happens most of the time in your legs, where you start to have pins and needles and tingling in your legs. So all of that doesn't happen overnight. It's not like you eat a cheeseburger when you leave here and all of a sudden you're not going to be able to see. That happens over a long period of time of your blood sugar level being high, and it starts to cause damage to your blood vessels, your nerves, and all your other organs, which is why you're at a higher risk of having blood pressure issues with diabetes, because it can damage your blood vessels and cause you to have blood pressure issues. So understanding the carbs in your food that you're eating will help you keep your blood sugar stable over a long period of time, hopefully mitigate any of these effects. If you manage it at a good level, hopefully for the rest of your life, you don't have to worry about anything like that. But it's going to take a lifetime of working on it and trying to tweak your diet. It's not going to happen overnight. So just don't get discouraged if you can't leave here and do this immediately. You just need to keep practicing it and working on it, and eventually you'll get to where you need to be. So your carbohydrates, if you ever question whether something is a healthy carb, stay away from anything processed or anything with added sugar. Just because something looks like it's a healthy carb doesn't necessarily mean it's good for you to have in high amounts. Moderation is key. And so pretty much we're going to ask you to fill up on non-starchy vegetables for your carbohydrate count and add another complex carb to fill in the gap on your carb count for each meal. We'll go over in a little bit what that actually means. So just some examples of complex versus simple carbohydrates. Complex carbs do digest slowly. They are more filling. They're harder for your body to process. So they do fill you up pretty quick. They do have more nutrients in them. They do include things like vegetables, brown rice, whole wheat bread, oats, and black beans. Your simple carbohydrates are easier for your body to process. They digest quickly. So it does include things with processed foods, added sugar. You'll see like cake, cereal, soda, stuff like that. But it also includes fruit and milk, and fruit and milk are okay to have. So usually, if you look at a graph like this, you'll say, well, obviously, this is the carbs that I want to stick with, and I want to cut all this stuff out. That's not necessarily true. What we're going to go over is how to use both simple and complex carbs in your diet together to help make a balanced diet. So the first key part of your diet that we're going to talk about is carb counting. This is going to be the hardest part of the diet. It does take practice. But this is something that you're going to really want to keep going at for a long time until you get used to it, to where eventually this will become second nature to you. I've been doing it for a while. I can go in a grocery store and pick up things and substitute things and know exactly what I can and can't have. And that's just because I've been doing carb counting for a long time. The easiest example I can give you as to how to do carb counting is when you look at the nutrition label, you're going to see total carbohydrates and you're going to see a serving size. So easy example I can give you is spaghetti with meat sauce. It's 3 ingredients, okay? Your meat is your protein. We're not going to count that. We're going to push that off to the side. We're going to count the sauce and the noodles. So when you look at the nutrition label for the noodles, you're going to see how many servings of those noodles you're going to have, how many total carbohydrates are in that one serving or those servings you're having of the noodles. You're going to do the exact same thing for the sauce. Whatever carbohydrate count you get for the noodles and the carbohydrate count you get for the sauce, you're going to add them together. And that's your total carbohydrates that you're eating for that one meal. That's important because you have to stay within a range for every single meal. Now, some people have asked about, well, we can look at the keto stuff that does like net carbs and you're subtracting fiber from total carbohydrates. So we don't teach net carbs. We actually want you guys to stay with total carbs because we want to make sure that you're eating everything that is a carbohydrate that can still affect your blood sugar. Even if it may only affect it slightly, it's still affecting your blood sugar. So we don't want you to cheat yourself and think that you're eating less carbs than what you're actually eating. That's why we tell you to stay with total carbs, okay? Practice this. When you get to the grocery store, plan your meals out for the next few days, next week, whatever it is. Take a calculator with you. Try to add up whatever you've already planned on making and see how many carbs you're actually eating for that meal. With those calculations, you can tend to tell what's easiest for you to take out of it, substitute for something else that's less carbs. But like I said, it's just going to take a while. You're just going to have to keep working on it until you get used to it. So carb counting, your ranges. Ranges are different for men and women. So women, you're going to have anywhere from 30 to 45 grams of carbs per meal. Men, you can have 50 to 60 grams of carbs per meal. This does say snacks should be no more than 15 grams of carbs. Don't worry about snacks right now. We're going to go over that in a slide in a second. So when you start this carb counting, you'll notice that even if you're at the higher end of your range, you'll actually start to lose weight anyways, and that's more than likely because you're not used to eating that portion size. When you start to reduce the carbs, you naturally start to reduce calories and portion sizes anyways. If that's your goal, great. Start losing the weight. At some point, you'll plateau and you'll stop losing the weight. If weight loss is still your goal, start going more towards the bottom of the range, and that'll keep you going with your weight loss. If you're happy with your weight, you want to stay with where you're at, stay more close to the top of the range, and that'll help you maintain your weight. But you want to have this range, like I said, every single meal. This is not per day, this is per meal. And you're going to have 3 meals a day, and you're going to have them consistently, which is, I'm sure, opposite of what you've been hearing based on keto diet standards. They probably want you to have this every single day. You're having about that much. That's not enough carbs for you to have every single day. You need more than that. So please try to stick with this. I've been asked, can we, let's say my range is 50 to 60, can I have, and I'm trying to stay close to 60 per meal, can I have 30 this meal and add another 30 to the next meal? No. The carbs are use it or lose it. For every single meal, you need to stay within that range. So protein is the second really important part to this diet. So you're going to have protein with every single meal. Do not skip out on protein for meals or snacks. You're going to have protein every single time. And the reason is because protein actually slows the absorption of carbohydrates into your system. Without protein, and you just have carbs, you're going to notice some sugar spikes because there's nothing really holding it back from your body processing those carbohydrates and turning them into glucose. So you always want to have protein. You can cook your protein any way you want as long as it's not fried. That's pretty much your only restriction. Just don't put it in oil and fry it. You can cook it any way you want other than that. This says have at least a 3-ounce size of a deck of cards on your plate of protein. Depending on what type of protein you're eating, I find that that's actually more about 17 to 18 grams of protein. So you want at least 20 grams of protein per meal for every single meal. So if I were you, I would advise you to go up a little bit bigger than 3 ounces or the size of a deck of cards just to make sure that you're getting enough protein. You don't want less than 20, at least 20, but it's not going to hurt you to go over 20. So you can have more protein if you want. You just want to make sure you're having enough to slow down the absorption of carbs into your system. So your types of protein you're going to stick with. You're going to stick with chicken, turkey, and fish. Those are the leaner meats, less fat, salt content as well. You're going to avoid red meat and pork. That does not mean completely cut out red meat and pork. If you have bacon every Sunday morning and that's your joy in life is to have bacon, I'm not going to tell you to take that away. If you have a steak on Friday night or something like that, that's not going to kill you. Have the steak, have the bacon. It's not that big of a deal because you're doing it once a week. But the majority of your meals, almost every single other meal, are going to be your lean meats. And then moderation is key with the other stuff. So don't go crazy with this, but I don't want to take away something that makes you happy either. You got to live. So, just try to be careful with it. The third most important part to this diet is eating consistently. When you eat consistently, it gives your body enough carbohydrates throughout the day to do its normal processes, breathing, thinking, moving, whatever it is. It also revs up your metabolism. It keeps your body from storing more glucose than what it's using. Our body naturally wants to store things for later use. If you're not eating enough, that storage of glucose will happen more, and you'll start to notice that it's going to come out later on in the day anyways. So I've actually had diabetics that I've worked with that have eaten breakfast and dinner, and lunchtime they're like, I don't know what's happening. I'm not eating anything, and I'm having, my sugar's going up for no reason. It's because they're moving around, they're doing things, they're exerting energy. They have to use that glucose that's stored in their body, and that starts to come back out. The easiest way that we've fixed that, add at lunch, a small lunch, just enough to get enough carbs and enough protein in their system, and those sugar spikes went away. It stabilized. So definitely always want to make sure that you're trying to eat consistently. That means stay around the same time every day. I would say no earlier than an hour before and no later than an hour after when you usually eat. So if you usually eat breakfast at 8 o'clock, try not to eat it earlier than 7. Try not to eat it later than 9, but preferably stay as close to that 8 o'clock time as much as you can. You're going to do that with lunch and dinner, and you're going to try to do that consistently every single day. Your meal prepping, which is why you guys have the Tupperware containers, that is going to be your best friend for staying on time. That allows you, whenever you're cooking a healthy meal for dinner, for lunch, for breakfast, whatever it is, if you want to cook more than what you know you're going to eat, have a second serving of it that you can put in those containers and slide it to the side for later. That will really help you so that later on when you're in a time crunch, you got to go somewhere and do something, you know you have something that you can slide in the microwave real quick, heat it up, and you can stay on time. So really try to work on meal prepping. There's no shame in if you go to cook dinner, you're cooking more than what you know you're going to eat, because all that's going to do is make sure that you're within your carb range on time later on. So really try to practice that. Meal portions. So when you look at this plate, a standard size plate that looks like this, as long as you're eating something that looks just like this, you're going to be pretty close to your carb range. If you're having trouble doing the carb counting and you're really stressed out about it and it's really not clicking as fast as you thought it would be, don't stop trying to do it. Don't stop practicing it. But in the meantime, if you want to be close to what your range is, try to have your plate look something close to this. Obviously, it's best to not have any potato, pasta, rice or anything like that because it doesn't have as much nutrients as your non-starchy vegetables do. If you can fill up on non-starchy vegetables and protein and that's it, that's even better. But what you'll find is, and we'll start looking at this when we look at the non-starchy vegetables, getting to your carbohydrate range just on non-starchy vegetables is actually pretty hard because there's such a little amount of carbohydrates in them. So a lot of times you have to, like I said before, fill in the gap. That means add that small amount, and I really do mean small amount of potato or pasta or whatever it is to help boost you into your range. So just try to stay with this while you're doing the carb counting, but always try to get the carb counting down and try to get exactly in your range. Try to do that. Fruit, no more than twice per day. I prefer you to only have it once per day. You can count it as a snack. Some people choose not to eat it as a snack, but with breakfast, since breakfast is actually lower on options for you to have for breakfast. Fruit is one of those things that it's good for you. It's filled with fiber, vitamins, minerals. It's got a lot of good things in it. However, it's really high in carbohydrates. And so the more you eat fruit, the easier it is to be out of your carbohydrate range. And so that's why I say preferably only have it once a day. And we'll go over some examples of what that means. But basically, the difference between a small and a large apple, which a large apple is basically what you're going to buy at the grocery store every time you go to the grocery store, is about 15 grams of carbs. If you have a small apple, it's 15 grams. If you have a big apple, it's about 30 grams of carbs in that one apple. So that should hopefully put it in perspective. If you're low in on your range is 30 grams, you're already at your range just by eating that one apple. So only have it as a snack or try to add it as part of your breakfast if you're low on options. So if you're out and about, you don't have any measuring spoons, no measuring cups, this is a quick way for you to kind of cheat and make a measurement, try to get your measurements right. It's not going to be exact. Everybody's hand sizes are different. But if you're at like a restaurant and you want to try to measure your food out, this should hopefully help you with getting pretty close to what you're looking for. So snacks should be no more than twice a day. Only eat snacks when you're hungry or to prevent low blood sugars. So what that means is when you're starting on this diet, if you're noticing that between your meals, your portion sizes are a lot smaller and you're actually really hungry between your meals, you can add a snack in between the meals just to help get you through it. And then as you get used to eating those portion sizes, you can back off on the snacks. Preventing low blood sugars, what that means is if you all of a sudden for some reason notice that your blood sugar is dipping in the middle of the night while you're trying to sleep, add a snack before you go to bed. That will help keep you up during the night so that when you wake up, hopefully it won't be low. If you go work out or if you go on a walk and you notice that every time you exercise, your blood sugar starts to dip, and then by the time you're done with the exercise, you have low blood sugars, try to eat a snack before you exercise so it has time to get into your system. So those are the ways that you're going to prevent low blood sugar. And just for hunger, in between meals is the way you want to go. But as far as snacks, you don't want to just eat a snack just to eat a snack. That's not really helpful. You're just throwing in extra carbs into your system throughout the day. It's not necessary unless you actually need it. So use it as a tool, but don't use it like it's something that you have to have. And this just says keep track of your blood sugar if checking it and try to time snacks when your blood sugar tends to get low. We kind of talked about that with exercise and your low blood sugar during sleep. So some healthy snack ideas. This is by no means a complete list. There's other things you can try to do. But pretty much you're going to want to stick to 15 grams of carbs and at least 5 grams of protein. So as long as you're right around 15 grams of carbs, as close as you can be with the carbohydrates, and at least 5 grams of protein, you're good. Ways of trying to get a healthy snack that's actually a little bit nutritious, has some good stuff in it, is the peanut butter that you see on here and an apple. You can slice up a small apple. Like we said before, a small apple's about 15 grams of carbs, and the small amount of peanut butter has at least 5 grams of protein. So that's one idea. You do have rice cakes and peanut butter, some Ritz crackers and cheese. I've had diabetics that have eaten one slice of wheat toast with some cheese on it. So there's, or a little bit of peanut butter. There's ways of doing it to where you can get pretty close to those estimates. So non-starchy vegetables, again, this is not a complete list. This is just giving you some examples of what you can eat. So usually you can just take these different types and mix them together if you start to get bored with eating one thing by itself. Sometimes when I make dinner, I mix like onions and bell peppers. You can mix up mushrooms with some stuff. You know, the same thing with Brussels sprouts, broccoli. Just try to mix it up if you start to get bored, but these are some examples. And 1 cup raw is 5 grams, but when you cook it, it goes up to 10 grams of carbs. That's important to remember because you're breaking down the food, you're converting things in the food as you're cooking it. It actually gets easier for your body to process. It actually does increase the carbohydrate amount when you cook it, which is actually a good thing because if you have to get to your range, you don't want to be eating a cup at 5 grams of carbs at a time to try to get you in your range. That's 10 cups of vegetables just to get to 50 grams. That's not feasible. That's a lot of vegetables. I don't know of anybody who can eat that many vegetables. So always try to cook it, 10 grams of carbs. Again, you can cook them any way you want. Just don't bread them, don't fry them. And you should have at least half your plate filled up with non-starchy vegetables. Starches and grains, high in carbohydrates. So this is just some examples. Bread is 1 slice at 15 grams. You'll notice that some things that you think are really good for you, like peas and corn, are actually really high in carbohydrates. I've known people that thought that they were having a really good meal and they filled up half their plate with peas, and they didn't know that they were actually like over 100 grams of carbs just from the peas. So try to make sure you're keeping track of what you're eating. If you have to, look it up real quick if you forget some things. And just try to be mindful of what type of vegetable you're eating. The unsweetened cereal, I tell you, you don't have to cut anything out of your diet. It's all in moderation. But if I could pick one thing that you would completely cut out of your diet for the rest of your life, it would be cereal. Because cereal is actually not that nutritious. And it is so high in carbohydrates at 3/4 of a cup. That's just an estimate, but we're not having 3/4 of a cup of cereal when we eat cereal. We're having a whole bowl of cereal, and you cannot eat 3/4 of a cup of cereal and feel satisfied. When you add the milk to it, it adds carbohydrates to it as well. So cereal by itself is one of those things that is basically tripling, sometimes quadrupling what you're supposed to have for your carbohydrate range just in one bowl of cereal. So again, I'm not telling you to cut out anything completely, but if you're going to eat this, you have to be extremely careful, and by the time you're done with it, you're probably not going to be very happy because that's your meal. So try to not eat this as much as you can. So examples of fruit that's high in carbohydrates. Again, we've talked about the small apple, 15 grams. 1 banana, a whole banana, is 30 grams of carbs. So if you have a half, it's at 15. Orange, 1 small orange, same as an apple, 15 grams. 3/4 cup of blueberries, that's 15 grams of carbs. Your milk, as I was saying before, a cup is about 15 grams of carbs. It doesn't matter if it's skim, whole milk, 2%, it's about 15 grams. There are some substitutes that you can use for milk, such as almond milk. I think almond milk is actually a lot lower in carbohydrates than regular milk. There's all kinds of stuff out there. You just got to look at the labels and make sure that before you use it, you're being aware of what you're putting in your body. So we won't go too much into fats and oils. Fats and oils, you got to use them sparingly. They do slow down rising blood sugar. Obviously, they're high in fat. But the reason I talk about this is because some people try to use oils as a way of lowering their blood sugar every day. And it's not a good idea because all you're doing is adding to your cholesterol. It's not really even making an impact on your blood sugar like that. So it's not really, I mean, I've known people who were taking shots of oil every day to try to lower the blood sugar. Don't do that. Oil is one of those things that you're only going to use when you're cooking something to make sure that it doesn't stick to whatever you're using to cook. So you're like your skillet, your pan, whatever it is. You can use it to marinate meat. That's fine. Sometimes people put oil in a bag with chicken or whatever and put seasoning in there so they can move the seasoning around the chicken. That's fine. Just know that when you take it out of that bag, you don't need to oil your skillet or anything else that you're using to cook, because the meat itself already has oil on it. So, and only try to use enough oil to move the seasoning around. If you're using it to marinate something, don't try to pour the entire bottle or put the bag like this at the bottom. When you sit the meat down, you've got it swimming in a pool of oil. Just try to use enough for it to move the seasoning around. Here's some examples of some suggested serving sizes at 5 grams of fat per serving. I won't get too much into this. We already know that this stuff is high in fat. The one main thing, though, I wanted to bring up is peanuts, whole peanuts. We do use peanut butter as a way of having a healthy snack, but the reason that is because when you use peanut butter, you're using about a tablespoon, and so that's such a low amount of fat within that one serving, and it's high enough in protein for your snack. That's a quick and easy way to add some protein to your healthy snacks and not have that much fat in it. However, if you were to take those same peanuts and dig your hand in a bag and eat them whole, you would be adding a lot of fat to your diet. You would add protein, but you would also be adding a lot of carbs to it as well. So nuts are one of those things that you shouldn't be trying to eat as a snack. Just be careful. All right, so we're on to the second part of our education. This is blood sugar tracking. What I will tell you guys is, if you're not checking your blood sugar, this is still good information for you to have for when you do have to check it, if you ever have to check it. If you are currently not told by your doctor to check your blood sugar, you're not at that point yet, I would suggest you still go get an emergency glucometer and keep it in your house. In the event that you do have some kind of episode of low blood sugar or high blood sugar, you don't want to be guessing what's going on. You want to have something on hand to pull out real quick and get an accurate number to see if you really are having an issue. So even if you're not checking it, try to get a glucometer and have it put somewhere. So as far as blood sugar tracking goes, you have a blood glucose log and you have your A1C. Those work together to tell your doctor whether or not your diabetes is being managed. So your blood glucose log, every time you check your blood glucose level, what you're going to do is you're going to try to be as specific but as brief as possible. What that means is, when you check, you're going to put the day, the time you checked it, what the result was, if you did eat before you checked it, how many hours before, and just a quick example of what you ate. Sandwich and chips, spaghetti and meat sauce, whatever it is. If you check for symptoms, put the day, the time, when you ate, all that stuff, but try to put what symptoms you had at the time as to why you checked. So all of that is important because you want to have it as brief as possible so it can fit on one line on your log. But you also want it to be as specific as possible so when your doctor goes in there and looks at what's going on with your numbers, they can pretty much see, okay, well, it's because you ate 2 hours beforehand and then you checked it, so of course it's going to be up a little bit, or you ate this and of course that's a little high in carbs, so that kind of messed you up a little bit. Things like that really help. I would also suggest, whenever you have a glucose log, if it's on an electronic device, have a paper backup. That is so important, because I can't even tell you how many phones and computers and tablets I've gone through in my entire life. And if you have it on there, everything that you've logged is lost. So always make sure you have some form of paper backup. And you can do that at the end of the day when you get home. If you're checking it during the day, when you get home, just make sure you write it down in your notebook or whatever you have your log, physical place where you have your log at. Your A1C is important because that has an average of what your blood sugar has been running for the last 3 months. So your doctor will look at that and see what percentage you're at to see on average how high your blood sugar has been over the last 3 months. That tells them if you're at a controlled level. So your A1C will be looked at. If there's something going on with your A1C, it's not at the right place, it's not trending in the right direction, it's not moving at all, those types of things, that's when the glucose log can be used with it, so your doctor can actually get down on a detailed level and see what's going on with your blood sugar levels. So always keep a blood sugar log whenever you do check your sugar, and please always, always go in for your A1C appointments. Do not ever miss your A1C appointments. They're very important. When you check your blood sugar, check it if you feel symptoms. Also check it whenever your doctor tells you to check it, whether it's 3 times a week, a day, whatever it is. If you find that you're checking your blood sugar more often because you're starting to feel weird and you check your blood sugar, just let your doctor know if you're starting to do it consistently. So let's say you're starting to feel like it's low, but you check it, it's not really low, but you're starting to feel like you have symptoms, and that's been happening for a couple of days, maybe 3 days. Just let your doctor know, something like that. It's not really an emergency if your blood sugar's not low, but you feel like you're having symptoms and you don't have to treat it. It's not really, it's kind of like, I'm not doing anything about it right now, but I do need to let somebody know. That would be important because your doctor needs to keep track of when you're starting to feel like you have to check your blood sugar more. And then we're going to go into, if you check it and you do have symptoms and your blood sugar is low, we'll go into that in a minute. But that is also, obviously, very important to let your doctor know about. So blood sugar tracking, always let your doctor know when you have a hypo, which is low, or hyperglycemic, that's high, episode. You want to treat and seek medical attention immediately for those episodes. We'll go over that in a second. Your blood sugar, this range of 80 to 130 is a very general range that most people should be fitting in when you wake up and before you eat. After you eat, that should be your stable level that you come back down to. That doesn't mean that you personally have to be at 80 to 130. I have seen some outliers of people being out of that range before. It's just whatever your doctor tells you is your number that they want you to be at. Whenever you're waking up, before you eat, and after you eat, what it comes back down to, your stable number. They should be able to tell you what that number is. Some people start to feel symptoms at different levels, so it just depends on what you personally should be at for your number. Generally, though, most people fit within the 80 to 130 before meals. When you eat, it'll go up to 180. Sometimes it'll go up to about 200. And then it'll start to come down. So the normal process for anybody who's not a diabetic is you'll eat for 2 hours, your blood sugar will start to go up. It'll peak at about 2 hours, and then the next 2 hours after that, it'll come back down to your stable level. So you have a 2-hour time of after you eat, that's when you're supposed to be peaking, and then 2 hours after, that's when you're supposed to be back at your stable level. If you're going to check your blood sugar just to check it, just to keep track of it, I would suggest don't check it 2 hours after you eat. I would give it a full cycle of maybe right before I eat lunch or right before I eat dinner or something like that. Or at least 4 hours after you've eaten a meal, just to make sure you've given your blood sugar enough time to go up and come back down. These are estimates about what your blood sugar level is with your A1C level. So if your A1C level is at 8%, your average is about 180. Same thing with 9, 215, so that's how you read that graph. That's not hugely important. Your doctor will tell you exactly which percentage they want you to be at for them to consider you controlled. However, we consider you controlled less than 8%. We want to see you less than 8% at least to consider you controlled. Others might consider it less than 9% for you to be controlled. The other note I've made is see if you qualify for a continuous glucometer. So continuous glucometers are like your Dexcom and your Libre. Those are the systems that you actually put on your body and you scan with your phone in order to keep track of your blood sugar. Those are fantastic for day-to-day management. If you just want to see where your blood sugar's been, where it's going, and keep a graph, great. For emergency situations, I would not use them. You still have to have a glucometer in case you start to feel symptoms, because when you start to feel symptoms, you're going to want to know what that actual number is at that moment. The Dexcom Libre systems, they tell you what your sugar level was about 30 minutes ago, and they give you an arrow on where it's headed. And you can't really use that. If you're feeling symptoms, you need to know where it's at, if your treatment is helping, and if you're coming up, if you're feeling great, all those things, you need to be able to tell an accurate number. However, the continuous glucometers have helped a lot of diabetics with day-to-day management, not having to prick their finger all the time. So they are great in actually motivating you to keep track of it, know what foods you're eating on a day-to-day basis are actually affecting your blood sugar in a negative way. If you want to see if you qualify, I would ask your doctor if you qualify and have them send something in to see if you can get one of those symptoms. One of those systems. If so, they may actually have a sample at the office that you can try out before you actually start to use them full time. All right, so we got 2 slides left. So this one is about low blood sugar symptoms or hypoglycemia. So some of these symptoms actually cross over into high blood sugar, hyperglycemia. So because some of these symptoms actually cross over between low and high blood sugar levels, that's another reason why it's very important before you try to treat anything, you check your blood sugar level and you find out where it's at. Because you may start eating things thinking that it's low and it's actually high, and then you've caused another issue. So always check your blood sugar level before you start to treat. But generally, we've seen people shaky, start sweating, tired. It's hard for them to stay awake. They get really confused. I've seen people who have, for no reason whatsoever, have all of a sudden been agitated, like really agitated. Those types of things are when you need to check your blood sugar. So if you check your blood sugar and you notice that it is low, you're feeling one of these symptoms, and you're able to safely swallow, that's when you want to treat. So I say safely swallow because if you're really confused or you're not able to stay awake and you're trying to jam something down your throat to eat and get your sugar up, I don't want you choking. And if you choke, then it's a second issue you got to worry about. We only want to do that if you're able to swallow. So if you're able to swallow, you're feeling the symptoms, your sugar level's low, what you're going to do is have something about 15 grams of carbs immediately, only after checking your blood sugar level. Again, that's very important. Some examples are orange juice and soda at 4 ounces. Glucose tabs are these things that they sell at like CVS, Walgreens. They're basically a hard candy that diabetics can use to help get their sugar up quickly. Or you can just use hard candies. I would avoid, this is the one time I will tell you this, avoid things with protein when treating your symptoms. When you're having symptoms and you need to treat, you don't want anything getting in the way of your blood sugar going up. And if you have protein mixed in with that snack, it's going to slow the absorption of carbs into your system. You don't want anything getting in the way. So I've seen some people that have carried around like payday bars in case they start getting low in sugar. And they're like, I don't understand why it's not working. It's because you're literally having so much protein. It's keeping whatever carbs are in that from actually getting into your system quick enough to make any meaningful impact. So don't do that. You only want to have something processed, something that's a simple carbohydrate, an added sugar, whatever it is. And so once you have that, you're going to wait about 15 minutes. And if you're feeling better, you check your blood sugar. Your sugar's coming up. You're getting back to stable level. You can wait about 15, 30 minutes, check it again, make sure that you're back at stable level. You're feeling better. You're okay. However, if you have that 15 grams of carbs, you're not feeling better, your sugar level is not coming up, you can have another 15 grams of carbs and do the same process again. Check it in 15 minutes, make sure you're feeling better, make sure your sugar level's coming up. If you've done this twice, don't do it anymore, go to the hospital. If you ever have any question whether or not you should go to the hospital, you should go to the hospital. Don't wait around. You know yourself better than anybody else. And if you're feeling like you're at the point where you might need to go to the hospital, you need to just go ahead and go to the hospital. If you treat it at home and you come back up to stable level, or if you go to the hospital and they treat you there and you get back up to stable level. Either way, once you're back at stable level, everything's good, you want to call your doctor's office immediately and let them know, hey, I just had a hypoglycemic event, a low blood sugar event, whatever you want to call it. I had to treat it. I went to the hospital, whatever it is. They need to make a note of that in your chart and keep track of it because your doctor may need to review your notes or review your medicines and get you in the room, the patient room right away to actually review what kind of medicine you're on, what dose, all that other stuff, what you've been eating, diet, tweak things, that type of thing. But you have to call them immediately only after you're back at stable level though. So hyperglycemia, again, blurred vision, weakness. So some things do cross over with high blood sugar. So this is a little bit harder to treat because with low blood sugar, all you can do is, you can eat something and it can come up. If you have a thing called like a hypo kit where you can inject sugar into your system, those things help. But with high blood sugar, the only thing that brings it down is insulin. And so if you don't have a plan with your doctor on dealing with high blood sugar levels and the insulin, the fast-acting insulin to help you with that, unfortunately, the only thing you can do is actually just go to the hospital. There are things like sliding scales. Your doctor can work with you on prescribing with fast-acting insulin for you to check your blood sugar level. If it's at a certain level, give yourself this much fast-acting insulin to make it go down. That's something that's going to be between you and your doctor. However, I will also tell you, if you have insulin at home that you're using every day, do not use that to take your blood sugar level down if it's high. Most of the time, you're just going to be prescribed long-acting insulin, and that long-acting insulin is not going to help you right now if you're having symptoms. So, like I said, if you don't have anything to help you, you have no plan with your doctor right now to help you, just call 911, go to the hospital. If your blood sugar is higher than normal for 3 days, you're not having any symptoms, you just notice that you're having abnormal levels, that's when you can call the doctor's office and let them know, hey, I'm okay, I haven't had any symptoms, but it is higher than usual. Just wanted to let y'all know because they may have to get you in the office to look at that and see what we need to do about adjusting your medicine or looking at your diet. And that's it. So, any questions from anybody?